Hello everyone, today's video is another Q&A video. I'm talking about stellate ganglion injections, talking about the difference between neural therapy and perineural or neural prolotherapy injections. Let's see, talking about the difference between powdered herbs versus herbal tinctures, talking about cyanide and apricot seeds, and UTI biofilms. So we're going to cram a whole bunch in there. A couple of them are pretty rapid fire, so try to get cram full of information in this Q&A. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare providers to get that advice. And if at some point you wouldn't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So first question here is perineural injections the same as neural therapy? Google wasn't so helpful. I've had lots of success with procaine, dextrose, and saline injections for treatment of scar tissue improvement and related nerve issues. So glad to hear about the benefits from those injections, and thanks for the question. So perineural injections and neural therapy, there's a lot of overlap between them. They are considered to be different. With traditional perineural injection therapy, most folks use a 5% dextrose solution. So you mentioned here you've used procaine, dextrose, and saline injections. It really just depends on the concentration of the dextrose, but generally with perineural, it uses a 5% dextrose in water or D5W solution. The way I do perineural injection therapy is I use procaine, which is generally what's used in neural therapy, but there's, anyways, just kind of differences, I guess, in approaches that are used sometimes, but I find that procaine tends to work better than using dextrose, but that's just my experience with it. So as far as the difference though, perineural injection therapy is generally used more for treating pain. Neural therapy can definitely be used to treat pain as well, but it's also used more functionally as well, say as like segmental therapy over different organs or glands to try to help them work better, or treating scar tissue, as was mentioned, kind of breaking up scar tissue, that type of thing. And then some folks take it a step further, or use it in a totally different way, I should say, and we'll use neural therapy to help with like removing like emotional blockages and different things like that as well. So neural therapy is a lot more diverse, I suppose one might say, but there's definitely a lot of overlap. If there's any more kind of specifics around that, I'm more than happy to post another video talking about this. They're both topics that are near and dear to my heart. I've been doing both types of injections for well over a decade now, and yeah, I'm happy to answer any other questions around that. On the same video, there's another question that happened to be about injections, and it says, what are your thoughts on stellate, it says stellar ganglion block, but I believe you're referring to a stellate ganglion, but I'm sure they're stellar for many folks, and other injections, especially for healing the vagus nerve. So I'm not sure about the ability of stellate ganglion blocks to heal the vagus nerve, or any injections to help heal the vagus nerve. As I was alluding to with that last answer, there neural therapy could potentially be used to help with nervous system regulation. I had this one patient, and she was a lovely, lovely person, history of a lot of trauma, and she was just wound up tighter than a top. And, just a lot of like disparate nervous system symptoms. It was just really, she was suffering a lot. And like within 1 minute of getting a couple of procaine shots into her, she would just relax visibly on the table. Like it was just perfect medicine for her sympathetic nervous system, just settling it right down. Or maybe it was really bolstering her vagus nerve and getting her parasympathetics online. I don't know, but her and like some other patients, like it's just magic for settling down the nervous system. It doesn't last perpetually in everyone, but it can be very, very helpful and very soothing for the nervous system. So maybe there's some vagus nerve overlap there. With stellate ganglion injections, I think they're awesome. I think that they have a potential like very helpful role in helping folks who are dealing with like PTSD and other types of like notable neurological, like mental emotional challenges, I should say. I really don't have any notable experience working with them, so I can't really speak to like how well they work clinically, but just from the information that I have looked at and heard other clinicians talk about, I think that they can potentially be really, really helpful, but I don't know enough about it. So if anybody listening has insight or input to add over and above what I've said, please consider sharing in the comment section below. But I do think they're really cool, and if I had easy access to someone doing stellate ganglion injections, I would definitely want to learn more and look at collaborating with them more. Right. And yeah, so another question on the same video. It's a very lovely little triplet here. So it says, what is stronger, powdered herbs or herbal tincture? What are the pros and cons of each? So thank you for the question. And what an interesting, lovely question. In my experience, herbal tinctures are markedly stronger than powdered herbs. I say that because we use these herbal formulas. I've mentioned them many times in other videos. These a combination of 8 herbs inspired by the late Stephen Buhner, a brilliant herbalist, and we use this for patients dealing with persistent borreliosis, also known as chronic Lyme, and different co-infections and chronic viral infections as well. So herbs like cryptolepis and alchornia and Japanese knotweed and things like that. And so we use these usually 2 herbal tinctures. Each formula has 4 of the herbs in question in there, and so that's kind of our standard go-to formula for a lot of the chronic infection patients that we're working with. But some patients are unable to take tinctures. Maybe they have a history of alcoholism, maybe there are religious reasons why they can't consume alcohol. There's just sometimes there are reasons. And so with those patients, we'll use the powdered versions of those herbs. And what we find is that they typically need about triple the dose of the powdered herb to get the same oomph as the tincture form of the herb. Actually, I have one patient, there might be more than one, but definitely one that I can think of, where she was on the tinctures and they were helping, but then for some reason, like she was just reacting to the alcohol, like she was having some side effects from that. And so she switched to the powdered herbs and found that she tolerated it better, but it also didn't work as well even at that triple dose. So there's definitely something about the extraction process with the tinctures, drawing out more of those water soluble compounds from the herb itself that makes it work better. The analogy that I would use is that, if you just handed somebody, like a dry tea bag with, some orange pico tea in there and said like, oh, just, stick that in your mouth and see if it's an enjoyable tea drinking experience. But like, this is awful. Like I need the tea to be extracted into the water. You need to put it in the hot water, let it steep, or if you just like did a little flash, dip of that orange pico bag into the hot water for just a second, you didn't let it steep properly for 5 minutes or whatever it was, then like you're just not going to extract all those compounds out of the herb optimally as you do with a tincture, with that tincturing process. So I think tinctures are quite a bit stronger. And yeah, in terms of pros and cons, basically not really any cons to the tinctures except that they taste bad, and some people just can't consume alcohol for some reason. But not really, I think I pretty much covered it there. So I don't think there's any therapeutic advantages to the powdered herbs, except some patients just can't take tinctures. So thank you for those questions. Very, very fun and interesting ones. A couple of quick rapid fires here. So someone had posted a question saying, probably on one of my biofilm videos, it's called Biofilms, Your Questions Answered. And it says, what about urinary tract infection biofilms? Nothing seems to be that effective. So I've mentioned this in some of my other biofilm videos, but just quickly, typically silver hydrosol is my go-to because we know it's rapidly excreted through the kidneys, and therefore what goes through the kidneys must go through the bladder as well. It's a good phase 2 biofilm disruptor. And then if that was not an option or was not seeming to pack enough punch, then I would use a combination of R plus alpha lipoic acid, bismuth subnitrate, which is complexed into a dithiol complex by a compounding pharmacy or supplement company, and then DMSA, or kind of more over-the-counter option would be with black cumin seed extract. So those will be the things that I would typically use for my patients. But with biofilms in anywhere, but especially in the urinary tract, sometimes you have to marinate them for quite a long time. It's like usually the matter of 3 to 6 months, give or take, to like really hit those biofilms adequately. So it's a long process. It's not like a 2 weeks, all said and done, but that varies from patient to patient. So last question here, another interesting one. So I have a video called The Best Test for Heavy Metals. And there's a comment here saying, I know it's not a heavy metal, but what are the limits of eating apricot kernels that contain cyanide before too much of that can be detrimental? Does it have an accumulative effect over time? How long is it in the body? So good question. Just don't really have anything. Oh, how am I doing for time here? Oh boy, we're getting close to the wire here. So I don't recommend apricot kernels for my patients, and I'm just really not sure if it's safe to use those in practice. I know folks do take them mostly for the lateral content. It's just not something that I actually recommend in practice. So this is mostly me just saying, like, be very, very cautious when consuming apricot seeds, because we want to be careful for the cyanide. Anyways, I'll leave it there for now. Any questions, just post in the comment section below.